After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an AirTamer Personal Air Purifier. It's easy to have filtered air with an AirTamer Personal Air Purifier. An AirTamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The AirTamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an AirTamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Sometimes my thumbs get in the way and my camera wasn't on, so that's what the delay was. I apologize. Very sorry about that. Anyway, we've got a program for you today, and one that I'm going to do by myself. And the reason for that is very simply this. I get patient after patient after patient who's been diagnosed with what they've been told is an arthritic condition. And they've told that they have to take X, whatever the drug is, you put the tag on it. And unfortunately, what happens over time is that because of the misdiagnosis in many cases, or the inappropriate treatment when it is diagnosed properly by happenstance, and I'm going to tell you why I mean happenstance, is that the condition begins to get worse over time. Now, arthritis is what we're talking about. And we're going to talk about the different forms of arthritic conditions and the ones that are really the most common. We'll talk about osteoarthritis to start with. We're going to talk a little bit about rheumatoid. We're going to talk a little bit about, the differences between that and psoriatic and gouty arthritis. And there's really dozens and dozens and dozens of really diagnosed appropriately types of arthritic condition. And we're going to talk about what those are. But how about let's start with this. You go to the doctor and you're complaining of shoulder pain or neck pain or back pain or your knees hurt or your ankles hurt. And they say, well, you know what? You have arthritis. Well, maybe you have arthritis. And maybe you don't. Maybe it's something else. But if you don't treat it correctly, or if you treat it inappropriately, now the problem is going to get progressively worse. So if you don't have an arthritic condition, but your doctor now puts you on a drug that suppresses immunological function and reaction, now you're exposed to other things happening. So you don't feel it as much because the inflammatory level, because that immune suppressive condition is not there. In the initial stages, that's what's causing you the pain, is that inflammation that comes about. And I want you to know there's a difference between arthritis and arthrosis. Itis, anytime you hear the word itis, there has to be a true inflammatory reaction that is causing a problem. Arthrosis simply means arthro joint, osis means there's a degeneration or damage to a joint space in the absence of an inflammatory reaction, that itis, if you will. So here's the deal. If you have joint damage and it doesn't seem to cause a problem, you don't have an inflammatory reaction that's triggering the pain cycle. Now, I'm making it very simple because I want you to get ahead of the curve here on this and begin to understand it. But when you go in, you complain of joint pain, or you tell your doctor you can't bend the way you're supposed to without it causing pain localized. There's a lot of reasons for that. And the reasoning simply could be the fact that you have structural pieces that are not in position the way they should be, and they're causing muscles to misfire, and pain patterns. These nociceptors is what they're called. They're nerves that, or parts of nerve cells that experience pain and report it to the brain. So what's a person to do? The person needs to make sure that their doc runs the right tests. And we're going to talk about those more specifically. So here's the deal. Running the right tests means functional orthopedic testing, range of motion testing, muscle testing specifically that are involved in that joint, but multiple muscles. It's like if they just do an arm pull down test on your shoulder and you have strength there, but it hurts you. Did they divide the muscles into the anterior deltoid, middle deltoid, posterior deltoid, serratus andicus, subclavius muscle, the pec muscles, and so there's a bunch of them. Which one of them might not be firing properly? If that's the case, then what's the next step? The next step is get some blood work and get some imaging done, like an old-fashioned x-ray, not necessarily a CAT scan, an MRI, and so forth, and see if there's, in fact, bone damage, and see if that joint space is altered in its spacing. So the next thing that you need to do is you got to get some blood work done. And there are many different things that you have to be aware of. So did your doc just send you out for a blood count and an RNA or an ANA, and anti-nuclear antibody that they do for rheumatoid or rheumatoid factor? Or did they do a cyclic citrullonated peptide? It's called CCP. Did they do an erythrocyte sedimentation rate, an ESR? Did they do a C-reactive protein? Did they do an anti-nuclear antibody? Did they do a full blood count? So if they didn't do that, they're setting things aside. And there's others. Did they run viral components? Did they run a stool test? Why a stool test? Why do we want to play in your gut? Because your immune system, 75 to 80% of your immune system is in your intestinal tract. So if we don't know what the microbiome is and all the good guys that are there, and are they adequate enough to support you? Are there other elements, other guys that are giving off-side products, these chemistries that your body can't handle if it gets overwhelmed, and they're floating into the different joints? So now you hurt something and it goes after that. So your doc says, well, you have rheumatoid arthritis, but you've been complaining about it for years. Did you look at your hands and see if you have those nodes, those nodulations there? They're called what? Heberden nodes. And if you don't have the Heberden nodes, then you probably don't have rheumatoid. So yes, you could have a rheumatoid factor that's elevated, but that rheumatoid factor and ANA are not completely diagnostic, if you will, of rheumatoid arthritis. There has to be other pieces of the puzzle that are in play as well. It's too easy because there's other pieces of immunological reaction that will allow that rheumatoid factor to rise. And you can't just simply say that's what it is. You have to look at other things. But Heberden nodes are those little bumps in your fingers, right in through here, right? And pretty soon, if it's true arthritis, then your hands begin to get gnarled and you can't open them up. And it's very damaging, but you can stop it very quickly. You can put it to rest very rapidly if you know where to look. Now, here's the situation. How many of you have gone to the dentist and the dentist says you have an infectious mouth? Well, if the mouth is infected, that leaks into the body. Now, what type of infection? Do we have bacterial? Do we have viral? Do we have heavy metal irritations, toxic metals, big old-fashioned, the silver amalgams that the dentists put in for years and years and years, and now they've leaked into your body and they're going other places. Years ago, they knew that if you had a bacterial infection, that you could end up with a rheumatic problem or streptococcal infection of the heart. But now we know through research that it can affect multiple areas of the body. See, here's an interesting thing that I want you to think about as we're talking about. Every tooth in your mouth has a energetic and a neurological relationship to different systems of your body and organ systems. Like the front teeth here, they relate to the gonadal area of the body. As you get a little further back into this area, now we're talking about the intestinal system. So those of you who are having problems here with recurrent infections, it's often the gut that's causing the problem that doesn't allow you to get this thing squared away. And then we go back and then we have the lung meridians and the lung channels and respiratory problems that come out seemingly out of nowhere. But if you understand that interconnected piece, now it makes more sense. And that's what I really want you to understand, that you can begin to put this into a place that you'll have a better understanding than your physician will. If we do a blood count, a CBC, complete blood count, that's where you measure red blood cells and white blood cells and the iron levels through hemoglobin and the size of the red blood cells called MCV, or mean corpuscle volume. That's like a pancake, that's the width. And then you have this RDW, that's the thickness, the fatness of the red cell. And then you have all the sub-factors of the white blood cells. And things like, neutrophils and lymphocytes and basophils and monocytes, eosinophils. Now, unfortunately, the parameters are very broad-based. What's happened over a period of years is that they're seeing more and more people that are not well. So the parameters are changing than what they were when I went to school many years ago. And they're making the assumption that, well, people are changing, that must be normal. It's not normal. We're just accepting something that shouldn't be normal. It should be within a certain parameter, and we don't have the sophistication anymore. My opinion of sophistication is the intuitiveness, the the willingness to take a look at the why behind that. You go see your doc today. Unfortunately, what does he do? Pulls the computer out, pounds on the keys, takes what you say, put it in there, pushes a button, says, here, take the script. That's not how you identify a problem. You have to look at the entire situation, particularly in an arthritic condition. We get too old, meaning time goes on, right? And your doc says, when you complain about pain, or you can't do this, you can't do that, or your knees hurt you when you're going up and down stairs, say, what do you expect for your age? Well, I don't know about all of you, but I'm in that place in my life where I'm their favorite target. They say, well, doc, what do you expect for your age? You have this, you have this. I went to a physician a few years back, and I wanted to get an EKG done and a treadmill because I push myself pretty hard. And I want to know exactly what it is that I can do and I can't do. And they put me through this testing. They did a flat EKG, then they did a couple other things. And, first thing, when I started filling out the forms, they asked me, and I think I was like, in 65, 66 years old. And what they said to me was really, well, it provoked me, and I'll tell you about it in a second here. What they said to me was, Doc, you forgot to fill out the part on your medications. I said, I don't take any medications. And she just looked at me like I was this weird person. And then I went in, they took my blood pressure, and while the girl is hooking me up for the EKG, this intake nurse comes in, she says, Dr. Roselle, you forgot to list your medications. I said, what's my blood pressure? She said, about 124/74. I said, my blood pressure normally runs 116, 118 over about 70. I said, if you quit asking me these questions, I'd probably go back down to normal. They look at me like I was this crazy person, but the difference is that I don't let my life catch up with, supposed this benchmark of years. So then I go in and see the doc, and he's sitting on the other side of the desk, and he's kind of got his glasses, if you will, like this, kind of strung over his nose, and he's looking at me over the top of them, and which irritated me to begin with. And I said, "Hey, listen," I said, "so what's new?" And he says, "Well," he said, "you have a slightly enlarged left ventricle." I said, "Okay, and he says, "You have a little bit of a periodic, your left or your mitral valve isn't firing the way it's supposed to." And I said, "Really?" I said, "Doc," I said, "I've been an elite athlete all my life, and that hasn't changed. And the reason I'm here is so I can continue pushing forward." I said, "But isn't that consistent with somebody who's been doing heavy stress type of exercises forever? And the fact that none of those mean anything as long as the rest of the graph is normal." And he said to me, he said, "I have to put you on an aspirin and a statin immediately, preventatively." I said, "What?" I said, "What?" It doesn't make it. So I told him all the literature that was out there that refuted what he just said. And it's in the medical literature. I quoted some studies from the New England Journal of Medicine and medical economics and so forth. And at this point, he's angry, and he looks at me and he says, "I owe you standard of care." Well, knowing me, the way I'm cut, that wasn't a good commentary to make. And I simply leaned over the desk as I stood up, and I said, "Doc, next time you have somebody in front of you, diagnose your patient, not your computer." And I walked out. So what I'm saying and offering to you is that none of us are a textbook. None of us are a drug laboratory, particularly when it comes to arthritic conditions. Understand there are many things that cause arthritis to really come about, or that arthrosis, that breakdown, that narrowing of the joint space. And it's not necessarily that you're destined to have a hip replacement or a knee replacement or a shoulder replacement or anything of that nature, or you're subject to those hands being gnarled and damaged over as time goes on. Now, it can be that way if you don't pay attention to them. And over time, you'll find that, you suffer the diagnosis of what they said that you have because of that overweight that you have, that lack of activity that you have, the food that you're consuming, the things that you shouldn't put in, like sugars and sodas and coffee and black teas and fast food and fried foods and alcohol and gluten and additives. And, the list goes on, right? You know what they are. In today's world, it's more easily found than good food, if you will. So if you're doing those things and you're not getting into place, and there's another piece of the puzzle that I want you to consider. Arthritis is lack of movement. And in my world, we look at structural components, and we look at biochemical, bioelectrical components, and we look at decision-making processes of the mind when diagnosing anything. You have to put them all together, and then you reflect them as they express in the manifestation and how the nerves work and how the biochemistry is working, blood supply, AAA garbage disposal, the lymphatic system, the acupuncture system, and the movement of spinal fluid. Those are the pathways that, when they're not working properly, actually cause you the symptoms and so forth. But we're going to look at those other pieces first. We have to make sure that we understand them, and so that we have control over them. But the mind is something that we set aside sometimes. And arthritis, the emotional component, when it comes to the mind, is simply this: you become inflexible in your attitude. So what's arthritis? It's an inflexibility of the joint spaces. We know that people who are inflexible in their attitudes, who are determined that this is the way life is, period, end of story. They don't learn anything new. They just compound the emotional insult one year after the other. They're the ones, interestingly enough, that end up more in a place of degenerative arthritic conditions over a period of time. Now, if that's the case, wouldn't it be wise to begin to take other considerations and kind of begin to change that a little bit? I don't know about you, But maybe that's what drives me all the time. And that's why I continue after all these years to want to know more and to be able to find out what's really, really going on in the world that we have. But arthritic conditions, osteoarthritis, wear and tear, if you will. That wear and tear comes, as we said, because of too much weight. That wear and tear comes because we're not exercising. That wear and tear comes from abnormal postural positioning and so forth. How many of you sleep on your stomach all the time and you have your head rotated and turned way to one side or the other, or you're locked up and so forth? That's going to insult the joint space. And over a period of time, you're going to get some damage and your body's going to respond by putting an inflammatory reaction in. Now, if you look up the risk factors of osteoarthritis, the first thing that comes up is aging. Why is that the first thing that comes up? It has nothing to do with your age. It has to do with neglect over a period of time. So if we stop neglecting ourselves and doing the things that are supportive of our body, guess what happens? We don't have arthritis at that point due to age. We have arthritis due to other things, but not of age. And then you'll talk about overweight and too fat. Well, there's a piece there, because if every pound you have around your waistline that shouldn't be there is 4 times on your knees. So if you got an extra 10 pounds around your waist, you got 40 pounds on your knees that increase wear and tear. Multiply that by how heavy it might be. Now, if you've ever had joint surgery, you've had a meniscus tear or something of that nature, you have a greater risk of ultimately having an arthritic condition of that knee joint. And overuse and so forth, you don't rest it, you don't do what you need to do. But overuse comes from, in my opinion, and what I've seen clinically for over 4 decades, is the fact that we don't know how to protect our joint spaces. And then obviously our dietary pathways and so forth and so on. Look, my mother, they're going to tell you, well, it's familiar, it's all in your family. My mother had very severe rheumatoid arthritis, but she didn't eat the way she's supposed to, and she was a drinker, and she, enjoyed her cigarettes. And back in the day, that's what all those people did. But she also was a hairdresser, right? So the postural pattern that she was in every day, and she should move the chair. She moved her body, and she was bent over in a position. She developed a curvature, and she developed degenerative disease, and so forth. That's what causes the problem: postural aberrations due to habit, biochemical insults because we're eating the wrong things. We're going out and we're going to all the fast food places where our body's highly acidic, that inflammatory reaction that goes on. Wouldn't it be great to stop it now? But in the initial stages, my joints hurt, they're stiff, I must have arthritis. No, you may have muscles that aren't working together because the nerves in your spine are being irritated because the vertebrae, for a lot of different reasons, the structural, chemical, emotional, by the way, are out of position. They're causing the nerves to be pinched, if you will, using that vernacular, but they're actually just being compromised in their motion or being overstretched. The cord as well, the spinal cord is like that. So when we understand that there's other pieces of the puzzle that we have to be aware of, why do we settle for a diagnosis, if you will, of, well, you must have arthritis? Not necessarily. If you let it go for any length of time, perhaps you're going to get that joint destruction, that bone destruction. So the next question becomes this, and this is the one that you should ask yourself. Is it reversible? Is this crazy arthritic condition something that you can turn around? You're going to find in today's world, there's a lot of evidence that begins to suggest that they may be possible. It depends on how far down the road you get. What happens if you have a bad hip and your doctor says to you, we got to do a hip replacement. It's the only way that you're going to get out of pain. But even though that the cartilage in the hip has narrowed somewhat, there's no bone destruction. It's just a narrowed cartilage. Do you know how many surgeries have been done on hips that should not have been done? And how many surgeries on hips that could have been avoided if things were done properly and actually see the joint spaces regenerate? The same thing with knees. Now, once you get to bone destruction, it's a little different story. And in today's world, in the world of stem cell therapies, and by the way, you can look up things like the Institute of Stem Cell Institute of Panama, in Panama, outside the country. Our government kind of controls what they publish, but you can go there, the website, and you can really look and see what's taking place. And Utah, by the way, May 1 now will be the first state that says, yes, you can use stem cell and say that they work for X, Y, and Z. Kind of interesting, right? We're hoping that it comes to our area in the state of Virginia, and obviously we're going to be all in that. There's exosomes, there's infusions that you can use to make sure that you're getting high levels of peptides in your body and so forth, and combinations of things. And now I'm skimming over those because we could spend, the next couple hours talking about peptides. We did a program recently with Dr. Shannon Gadon and just touched the surface of that, but we're going to get more into that as time goes on. But what I want you to understand, what I want you to know is that arthritic degenerative conditions can be, one, stopped if you're willing to make some lifestyle changes. Two, can be reversed if you supply the nutrient bases, particularly and specifically if the cartilage hasn't diminished. Now, completely where you have bone on bone and now the bone's involved, but if the cartilage space is shortened and the bone is still intact, you'd be surprised how that can be resolved, providing your willingness to shift and change things. So we're talking about multiple pieces of this puzzle. So having pain is not arthritis. The inability to lift your arms is not necessarily arthritis. That constant nagging pain in your neck going into your shoulders is not necessarily arthritis. It can simply be postural imbalances. If you go on to another website where I teach doctors called Leadership to Legacy, and I'm demonstrating something for doctors where I'm saying to this patient, I said, hold my wrist like this and don't let me move it. And I just move my hand out, and all of a sudden, she doesn't understand why she can't hold on. Then all of a sudden I said, pull your shoulder blades together. So what did I do? I had her artificially strengthen the muscles that hold the shoulder blades together. They're called the rhomboid muscles. And I had her try it again. And guess what happened? Now she has the strength. Now her hand worked. Now she had the ability to hold me from taking my arm away. And all she did was strengthen her back muscles. So how many of you are neglecting back muscles? How many of you are in posture patterns where you're bent over like this all day long? You're overstretching your back muscles. Your pectoral muscles, these muscles up here now are so tight that all you have to do is go in and do this, and it hurts. It doesn't feel good. Simply because of the fact that we're not exercising the opposing muscles to get them. And I'm not talking about being an Olympian. I'm talking about taking a band and pulling on the door and strengthening your shoulders and pulling back together and strengthening your shoulders and so forth. Just doing simple things like that. How many of you don't walk? You find the closest spot to the door with your car instead of maybe walking, 50 steps to get into the building. The more you do, see the old cliche, if you don't use it, you lose it. Well, this is very true when it comes to arthritic degeneration. You will go in arthritic problem if you don't respect and do things with your body the way they're supposed to. So what I want you to understand, there are people who are really aware of this. But unfortunately, you have other intentions called big pharma. My opinion, this is me in an opinion, that want to sell you a drug and suppress immunological reactions so you don't feel the symptom. Why? Does it make any sense to you when you see the television advertising, you hear it on the radio, you see it in print someplace, and it says, take this for that. You have rheumatoid arthritis. Take this immunological suppressive drug. Take these things. And guess what happens? The pain goes away. But you forgot to listen to the warnings that it can cause all these other suppressive symptoms, including death. I don't know about you, but that's really not up my alley. It's not something that I really want to pursue. So what do we do? So, well, I'm just going to take aspirin and Advil and Motrin and so forth. Well, those NSAIDs, those non-steroidal anti-inflammatory drugs, now create what it is that you're trying to prevent from occurring. That's called joint degeneration. Why does that happen? Simply for this reason. When you take an NSAID, Advil, Motrin, whatever it is, to knock the inflammation and swelling down, what you're doing is you're having it compete in the joint space for these receptors, okay, hand and glove type of thing, for these receptors that attract sulfite ion. Why is that important? That's what restores cartilaginous integrity and allows your cartilage to grow within the joint space that's being broken down. Interesting, right? So if it competes for that, now even if you put a ton of it in there, you go out and you buy glucosamine sulfate, which is the only one that you should be using if you want to restore joint space. Now what happens is that it can't get into the joint because you're taking aspirin all the time. Plus it makes you bleed, which is going to cause an inflammatory reaction and so forth. So it's like a vicious cycle of trying to put the fire out, but degeneration. How many of you have more than, a couple drinks a week? If you're doing that, you're causing your liver not to work and you're going to have backup and inflammation and so forth and so on. How many of you have bad bowel movements, meaning that you don't have at least one good, healthy dump every day? If that's you, guess what you got? A lot of inflammation. You got these chemicals that are in the intestinal lining now that are being absorbed into your system that are going to cause damage in organ systems, but also in joint spaces. How many of you, your diet is a candy bar and a soda or a cup of coffee because you don't have time to go do something? That's going to cause inflammatory reaction. Inflammation kills, my friends. But more importantly, it causes joint spaces to break down and degenerate. You go out and you go to the gym. I'm going to go work out. And afterwards, what do? You stop at the soda bar and you grab something that you know damn well you shouldn't be putting in your body, but you do it anyway. So if that's the case, don't be surprised when your body doesn't work the way it's supposed to. You have to make sure that you know what the rules are of your body. You have to make sure that you understand that you really have total and complete control of most everything that goes on. And if you ignore it, then you have this thing that will cause you not to be functional, to be immobile, have that wear and tear on an ongoing basis. I don't know about you, but I think that I would do probably anything that I could possibly do to resolve pain patterns before I put any of that stuff in my body. It seems to be we want things that are too easy. Here's one thing that I really want you to understand. There's a type of arthritis that ultimately becomes not only destructive, but it allows you to be, the old expression, this is not it, called stiff man syndrome. It's called ankylosing spondylitis, ankylosing spondylosis. And that means that the joints now begin to fuse. You take an x-ray of somebody with this type of condition on their spine, and you see this bridging that takes place from one bone to the other, and there's no motion. They can't bend, they can't extend, and so forth. And pretty soon, because it's so systemic, it will kill the patient over a period of time. So you have that ankylosing problem, and we know that the inflammatory level is extremely high, but it's a gut immune bacterium problem, and it's being treated the wrong way across the board. If you can identify it rapidly and not just take the immune suppressive drugs that they want to give you, you might be able to beat this thing. How about psoriatic arthritis? We heard about psoriasis, and they tell you that, they'll make the spots disappear within 6 months and you get how much clarity. Well, psoriasis is an intestinal tract liver function problem. And they don't address that. And I've had patient after patient over many years that we treat our way, neurologically, biochemically, immunologically. And when they do it the right way and they're willing to take control and responsibility for their health, the psoriasis clears up quickly. But here's the other piece. You can end up with psoriatic degenerative arthritis of any of the joint spaces, but particularly the spine over a period of time. And if that's the case, pretty soon you got a problem, big one. It's going to break other things down. But we have to understand the inflammatory reactions that take place and what they're triggered by. If you get that, if you understand it, if you're able to say, hey, this is not okay, you might be able to get yourself in a better place. But stay away from the immunological drugs, stay away from, and I think if I remember, Skyrizi is what they're talking about when it comes to psoriatic arthritis. It's craziness. My opinion, you have to make sure that we've become a society that we're too easily led. Think about what's happened over the last several years. We say, oh, okay, I'm all in, because they do great marketing. They don't give you the information to think. You're smart people, and you need to have the truth. My old cliche is, I need to provoke you. Don't believe me or anybody else. Do your own homework, but do it more than one site. Just don't go to Dr. Google. Don't go to, the CDC sites. Don't go to, there's a lot of other pieces. Go to the Townsend newsletter. Go to PubMed. It's an NIH site, and you can begin to do your own homework. If all of a sudden you start reading information that doesn't make sense, then understand that if I were you, I probably wouldn't be following that path. I would look for other ways. See, your body is a naturally forgiving organism. It does an amazing job of restoration, repair, if you put it in the right place. But when we put up with things, say you start having a knee problem, right? And you put up with it, and you put up with it, and you put up with it, think it's going to rust up and go away. It gets degenerative over time. Now you've got that degenerative arthritis. It's better to find it and fix it early and restore function rather than letting it move forward over a period of too much time, too many years, and now you have joint damage. If somebody has a dropped arch in their foot, the muscles are inhibited. Guess what's going to happen? The old cliche, the ankle bone's connected to the knee bone, connected to the hip bone, connected. All those systems are going to break down. And the one that has the most wear and tear or overuse is the one that's going to catch it first. Most of them will get it sooner or later. So here's the situation. You can fix this. In Fairfax, on this coming 10th of April, the Roselle Center for Healing, obviously, which I'm very much part of, is going to do an in-house program on arthritic degeneration and what you can do about it. Love to have you join us. Go on site at drtomroselle.com and check it out. Happy to see you. Happy to meet you. We have, obviously, there's many of you who are all over the country, and you're not going to be able to fly in to do it. But if I can help you in any way, ever, send me a note. I will respond. We'll get you the information that you need to have. And more importantly, we will refer you to doctors that I personally trust that can make a difference and can guide you the right way. But here's the deal. You have to make sure that you're ready to change things. You have to make sure that you're ready to restore things that may take a little time to get there, instead of looking for this magic wand, this magic pill, this formula that's going to work overnight. Let me tell you something. There's nutrition that can help. There's neurochemistries that can help if they're restored properly. There are a lot of things you can do, but there is nothing that will work overnight. Now, there are drugs that seem to be miraculous, but they're causing degenerative disease and further suppression of immune system. Wouldn't you like to do this on your own? Wouldn't you like to restore this and make it better on your own? Changing some dietary patterns, desensitizing some of the dietary sensitivities, fixing your mouth if that's the problem, change your attitude, get a new focus, or look at life. Yes, that will make a huge difference. Believe it or not, it does. Structural, chemical, emotional. Let me help you any way that I can. I'm easily found. Go to drtomroselle.com. Got another great program coming up for you next week. I hope you enjoy these. Let me know if there's very specific topics and interviews of different people that you'd like me to reach out to. Happy to do that for you. That's why I'm here. I love you all. I'll see you next time.